Snowdon, Shadow Assistant Minister for Indigenous Health and member for Lingiari. That's all of the Northern Territory except Darwin and Palmerston, and includes Christmas and the Cocos Islands. So I know a little bit about remote health.
And so what did you learn today about remote health that you didn't know before, and indeed health across the sector?
Not a lot of new information about remote health, but I did learn a lot about the need for greater integration between all levels of healthcare to get a more comprehensive approach. And I was pleasantly surprised by the common language around collaboration and the need to actually understand the primacy of people taking control of their own lives and the need to deal with communities at a community level. I think that was really very important because, in my view, and this is a view which is reflected in our Aboriginal and Torres Strait Islander health policy, the people we need to engage with are the people who are responsible for their own care, but most importantly in their community. And I was pleased that the National Aboriginal and Torres Strait Islander Health Plan got a mention a few times. I think it's an excellent framework for looking at a whole range of issues, including issues which are raised here, and which are recognised as important across every level, the social determinants, health, education, employment, housing, and I was talking to someone about rheumatic heart disease, for example, and we need to understand that these are largely preventable diseases which we can actually affect change in by bringing all these other sectors together.
Now, how can the people who are here and the people who are so invested in health policy, particularly in Indigenous health, how do they know that this actually produces anything?
I think well, firstly, there'll be no immediate outcome. The outcomes will be reinforcing our already good policies on Aboriginal and Torres Strait Islander health, but I think they lead us to the next step. We've got the health plan. There's an implementation strategy which I think needs some tweaking, but most importantly, it's our undertaking to work in partnership and collaboration with Aboriginal and Torres Strait Islander people, which is what we've done. We won't be doing anything in front of. We'll be doing anything with.
Although that was raised today by the NATSHO chair, who said that you did do Medicare locals without them, and
that was prior to the National Aboriginal and Torres Strait Islander Health Plan. And what we did do was get, as a result of the developing of the health plan, that process led to a compulsion of Medicare locals having to engage the local HOs, which is not the case really with the new structure, and I think that's an issue which is of great importance to people. I think one of the, I think another issue which is I think appreciated here and was certainly articulated was the differential that exists across the health sector in Australia, the workforce shortages in the bush, the need for infrastructure in the bush, the understanding that food security and issues like that are fundamental if we're to change health outcomes for people, the preventative health messages. I didn't go to the preventative health session, but I know Mike Daub and others very well, so I know what messages they were giving, and I concur with them. I think it's extremely important that if we want to actually improve, from my position, Aboriginal and Torres Strait Islander health outcomes, then prevention is a start. We're actually doing a lot of work, and with Mike Freeland, who's a doctor, a paediatrician, who's a member of the Labor Party in the Parliament here, working together with him, developing an approach to the first 1,000 days, which is being driven very strongly by Kerry Arabina at the University of Melbourne, and that's us saying that if we want to improve the long-term health outcomes for Aboriginal and Torres Strait Islander people, we've got to start at the beginning of life and work and invest a lot more of our resources at that stage, so that the markers that will inevitably determine what the life outcomes for those young people are actually affected by what we do in utero, prior to conception really, but in utero in the period after, up to the age of 2 years, and then onwards into the school.
All of those issues, of course, are very important, and you're working up a policy document for the election and then beyond if and when you win government. In the meantime, they're very acute, very urgent, particularly around Indigenous health. Is there any way that you can work better with government, given Ken Wyatt is now Indigenous Health Minister and has said some very welcome things for the communities, but also that you've got a chance to circumvent?
Yeah, no, we've got a process now, and all credit to Ken. a process now where we meet. We'll be meeting every sitting fortnight. The first Tuesday of every sitting fortnight, we've got a meeting set for 6 o'clock in the evening.
Who's we? You and him?
Ken White, myself and Pat Dodson. And that's, so we want to work collaboratively. We'll have differences on the edges and we'll be critical from time to time, but fundamentally we share an objective, and that objective is to improve Aboriginal and Torres Strait Islander health outcomes. He understands our priorities and we understand his priorities and we share many of them. So I don't think we'll have an issue there. As I say though, we will be critical from time to time, but by and large we're trying to work hand in glove.
And can you say anything that's early on the agenda in those talks?
No, because we've just started that process, but we did have a meeting with the implementation team for the implementation strategy for the health plan the other day, and that was useful. I think there's an openness, and we'll have things we need to push from time to time, but fundamentally, if we can work in a cross-party, collaborative, cross-parliamentary way with Ken, then I think that's all the better for everyone. We don't want to be throwing grenades from trenches from 50 metres. We want to be sitting next to people talking to them.
And what's Labor's commitment to the Redfern statement?
Well, we're very committed to the outcomes. The issue for us is that we've got to make sure, well, we've got to be the government firstly, but clearly we've got to be working in partnership with Aboriginal and Torres Strait Islander people. I mean, the days are gone, and I think sadly we're still suffering a bit of this, not in the health space so much. We're still suffering from this government doing things to Aboriginal people, not with them, and that's a problem.
Thank you very much for your time.
It's my pleasure.
Oh,
Thank you.
Sorry, I did have one more question, which is, Nicola Roxon said it as you were leaving government in 2013 about trying, what you can do to get health issues on the agenda. And she said she found it very frustrating with obesity that people didn't come to her with something that was like tobacco, where you knew no tobacco was any good, and her point being that it's much more nuanced and everybody wants different things. What do you want to hear from health advocates, public health advocates?
Oh, I think from my perspective, the public health advocacy is quite sophisticated, but it's very hard to translate obesity to action without people. I mean, Bill talked today about advertising of junk foods. I think that's a really important thing. There's a debate about the sugar tax. There's a debate about food security generally. There's a debate about educating people about what the right foods are. In the remote community sense, there's a discussion with stores about what foods to put in the stores and how to actually manage engagement with the communities about diet. I think it's a very complicated area, but there are actions that can be taken, but it does rely on people understanding that if we want to improve the long-term health outcomes, obesity is only a sign for something which is inevitably going to follow, whether it's cardiovascular disease, diabetes, renal failure, whatever it is. We know there'll be chronic diseases which follow, and if we don't address the stuff at the outset, which is why we go to the prevention page, then we're not going to have success addressing obesity.
Fantastic. Thank you very much.
Cheers.